huge news coming out of California. They currently have a Medicare for All bill that could one day be a model for the rest of the nation. So this is something that I was waiting for because, when one state implements something, there's a likelihood that the domino effect could occur. So we saw this with pot legalization. So it was Washington and Colorado that legalized marijuana first, and then 2 years later we saw Oregon and Alaska and Washington, D.C. do it, and then another 2 years later we saw California do it, and other states. So it just takes one state really to get the ball rolling, and if California does in fact pass this bill, we could be looking at nationwide Medicare for All if it does in fact work out for them. And California is a great state for this because they have a large population. And one of the main complaints about Medicare for All in the United States by naysayers is that, you can't actually compare the United States to Canada or the United Kingdom because we just have a larger population. But they fail to realize that we pay more per capita on healthcare than those nations that have a single-payer system, when you'd think they would be paying more. But that's not the case. So this bill is very important to all of us. We all have a vested interest in this bill. Now, there is good and bad news with respect to this bill. Now, predictably, there are special interests right now, namely the health insurance industry, that they're against it. They're going to fight tooth and nail, and unfortunately, there's a lot of people in the legislature in California funded by the health insurance industry. So International Business Times explains, since the 2010 election, the 24 lawmakers on the 2 California legislative committees that will consider the single-payer legislation have collectively received more than $819,000 in donations from the industry groups that are officially opposing the measure. The cash haul includes more than $80,000 to chairmen of the Assembly and Senate Health Committees, the latter of which is set to consider the legislation at a public hearing Wednesday. The groups opposing the bill are listed on a new state report. It also lists the bill's supporters, primarily grassroots advocacy organizations and labor unions rather than corporate groups. In addition to the cash that has flowed to individual legislatures from corporate groups opposing the legislation, California's Democratic and Republican parties received more than $2.2 million from the same groups in the last 4 election cycles. House Speaker Anthony Rendon, Senate President Kevin DeLeon, and Governor Jerry Brown, all Democrats, have all separately received a combined $370,000 from groups. Brown recently expressed skepticism about the single-payer legislation. So that's the bad news. You have special interests, predictably so, making sure they do everything they can to defeat this bill, because let's be honest here, this bill poses an existential threat to health insurance companies in the state of California, and they are fighting for their lives right now. But unfortunately for them, the American people are also fighting for their lives. There are Californians that are fighting for their lives who were left out by the Affordable Care Act, and they need health care. We can no longer allow our citizens to die or go bankrupt if they can't afford insurance. It's not what you do in a nation that purports to take care of its own. Now, the good news is that this bill isn't actually dead on arrival, in spite of all of the money being spent to stop it from ever seeing the light of day. So the New York Times reports a proposal to eliminate health insurance companies and guarantee government-funded health care for all California residents is moving forward. So the Senate Health Committee voted Wednesday to send the measure to the Appropriations Committee. The vote came after hundreds of nurses, clad in red, held a rally in Sacramento, marched to the state capitol, and packed into a committee room. Make no mistake about it, grassroots activism facilitated the advancement of this bill. And if this bill actually does pass, it will in fact be because of relentless grassroots activism. So if you live in the state of California, you know what to do. You've got to start making some calls immediately. But understand that progressives from around the country will be on your side. We're fighting with you because this is something that it doesn't just benefit Californians. If this passes, this will benefit all of us, because again, this could be a model for the rest of the country. And what we can do for those of us that don't live in the state of California is call up the governor, Jerry Brown, because if the governor, who's the leader of the Californian Democratic Party, communicates to his party that this bill should pass, then that would be a big boost, not just in terms of getting more people to come on board, but in terms of the media coverage it would generate when you get a governor of one of the most populous states in the nation come out in favor of this bill. But he's expressed skepticism. Not acceptable, so I'm going to call Governor Jerry Brown to make sure that he knows that this bill must pass. His number is 916-445-2841.
Thank you for calling the office of Governor Jerry Brown. In order to expedite your call, please select from the following options. To continue in English, please press 1 now. For office hours, mailing address, fax number, or to email the office of Governor Brown, please press 1. If you'd like to speak to a representative, please press 4. Please hold while your call is being transferred. If you have reached this message, our office is closed. Please try calling back during normal business hours, Monday through Friday, 9 a.m. to 5 p.m., excluding holidays. You can also visit our website at www.gov.ca.gov to request assistance or to leave a comment. Thank you.
We'll try that again.
.gov to request assistance or to leave a comment. Thank you.
Okay, so apparently we're going to have to email Governor Jerry Brown because I don't know what the hell that is. So give it a try. Hopefully you can get through and have better luck than I did, but certainly we all have to come together and help Californians get this bill through Congress, through their state legislature, that is, because this is something that this will benefit all of us. This could be the start of a nationwide healthcare, Medicare for all bill that would save lives, literally. So this is incredibly important. In any state that's legislature puts forward a bill like this, we've all got to come to the rescue of it, because, you know, what's good for one state will most likely occur at other states as well. We need this domino effect to start, and California would be a great state to lead the way. So yeah, this is really an encouraging thing to see. This segment of the Humanist Report is sponsored by Lunar Data Systems, who launched an Indiegogo campaign to fund production for the Pluto Project, which is a computer monitor designed to ensure the utmost privacy through the use of glasses that allows only you to see what's on your computer monitor. And if you think this looks cool, which it does, they are offering these perks to supporters of the campaign. Support their Indiegogo campaign to fund the Pluto Project by visiting the link down below.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.